This is Module 2, flashcards for the NASM Certified Personal Trainer exam. Here we go. A series of measurements that helps determine the current health and fitness level of a client. Comprehensive fitness assessment. Information that is gathered from a client including health, history, and medical background. Subjective information. Measurable data about a client's physical state such as body composition, movement, and cardiovascular ability. Objective information. Medications that decrease heart rate and blood pressure. Beta blockers. Knowing a client's occupation provides insight into what? Movement capacity and potential repetitive movements. What is considered relevant information regarding a client's occupation and movement capacity? Extended periods of sitting, repetitive movements, dress shoes, mental stress. What are some lifestyle questions the fitness professional should ask when conducting a fitness assessment? Recreation and hobbies. Questionnaire designed to qualify a person to participate in exercise and determine if referral to a physician is needed. Physical activity readiness questionnaire, PAR-Q. A client's chronic conditions, past surgeries, injuries, and medications, medical history. What can be caused by injuries or past surgery if not properly rehabilitated? Pain, inflammation, and increased risk of re-injury. What percentage of Americans do not engage in at least 30 minutes of low to moderate activity every day? 75%. Heart disease, hypertension, pulmonary disease, type 1 and type 2 diabetes, and arthritis are all common examples of what? Chronic conditions. Something specifically detrimental to an individual due to a special need or chronic condition. Contradicted. What position is contradicted for individuals with high blood pressure? Supine. What is the procedure for taking a client's radial pulse? Touch should be gentle. Take when the client is calm. 2 fingers along the right side of the arm, just above the thumb. Take for 60 seconds, average over 3 days while taking the pulse at the same time each day. Pulse taken on the neck to the side of the larynx. Cardial pulse. Cardial pulse. What are the 5 types of objective assessments that can be performed with clients as part of comprehensive fitness assessment? Physiological, postural, performance, body composition, and cardiorespiratory. What determines a client's baseline levels from which to compare progress to at later dates? Objective assessments. What provides information about a client's overall health, such as resting heart rate and blood pressure? Physiological assessments. What is the average resting heart rate for a male? 70 BPM. What is the average resting heart rate for a female? 75 BPM. The pressure of circulating blood against the walls of the blood vessel after blood is ejected from the heart. Blood pressure. The pressure within the arterial system after the heart contracts. Systolic top number of blood pressure reading. The pressure within the arterial system when the heart is resting and flooding with blood. Diastolic bottom number of blood pressure reading. What is an acceptable systolic blood pressure? Less than 120 mmHg. What is an acceptable diastolic blood pressure? Less than 80 mmHg. An indication that the client's ankle complex will be in a planar flexed position for extended periods of time based on occupation. Wearing dress shoes. What are some methods for measuring body fat? Underwater weighing, biometrical independence, and skin fold calipers. Where does the very high BMI score begin for non-athletes? 35. The method of measuring body fat percentage that conducts an electrical current through the body to measure body fat. Biometric independence. What are the 4 skin fold sites tested when using the Duren-Wormsley formula for body fat assessment? Biceps, triceps, subscapular, iliac crest. What is the at-risk waist to hip ratio for females? 0.8. What is the at-risk waist to hip ratio for males? 0.95. Risk for disease increased when a non-athlete's BMI exceeds what? 25. What is the equation used to assess a client's body mass index, BMI? Weight in kilograms divided by height in meters squared. For which clients is the use of skin calipers not recommended? Very overweight clients. Where is the hip measurement taken when conducting circumference measurements? Widest portion of the buttocks. Why should the fitness professional obtain client circumference measurements in the initial assessment? Provides feedback about client progress, can be used to calculate waist to hip ratio. What is the most important factor to consider when taking circumference measurements? Consistency. Why is BMI a poor indicator of body fat versus lean body mass? Only takes weight and height into account. The relative percentage of body weight that is fat versus fat-free tissue. Body composition. What is the typical body fat percentage for healthy active men? 10 to 20%. What is the typical body fat percentage for healthy active women? 20 to 30%. Assessment that measures the fat percent in the subcutaneous regions of the body is proportional to the overall body fatness. Skin fold measurement. What is the technique for biceps skin fold measurements? Vertical fold on the front of the arm over the center of the biceps muscle. What is the technique for tricep skin fold measurement? Vertical fold on the back of the arm halfway between the shoulder and the elbow. What is the technique for subscapular skin fold measurement? 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. What is the technique for the iliac crest skin fold measurement? 45-degree angle just above the iliac crest and medial to the axillary line. On which side of the body should all skin fold measurements be taken? Right side. Which is the BMI range with the lowest risk of disease? 22 to 24.9. What are the 2 common submaximal assessments that measure cardiorespiratory capability? YMCA 3-minute step test and Rockport walk test. A zone of cardiorespiratory training when a client scores poor or fair during submaximal cardio assessments. Zone 1. What is the straight percentage equation for predicting max heart rate? 220 to age. What is the regression formula for determining HR max? 208 subtract 0.7 times the age. The greatest number of times an individual's heart beats in 1 minute at maximal exertion. Maximal heart rate, HR max. What are the criteria for performing the 3-minute step test? 96 steps per minute, 12-inch step for 3 minutes, take pulse for 60 seconds within 5 seconds of completing the exercise. What is the percentage range of HR max for training zone 1? 65 to 75%. What is the percentage range of HR max for training zone 2? 76 to 85%. What is the percentage range of HR max for training zone 3? 86 to 95%. What is the technique for performing the Rockport test? Record client's weight, have client walk 1 mile as fast as they can without breaking into a jog. Record the time it takes to complete the walk. Record the recovery pulse for 1 minute. Use formula to determine VO2 score aligned to heart rate zone. What is the observable movement compensation when the hip flexor complex and erector spine are overactive? Low back arches. What is the observable movement compensation when the upper trapezius, sternocleidomastoid, and levator scapulate are overactive? Shoulder evaluation, head protrudes forward. Assessments that measure upper extremity muscular efficiency. Pushing and pulling assessment. What develops when the structural integrity of the body has been compromised as a result of disruption in one or more of the components in the kinetic chain? Postural distortion patterns. Which muscles could possibly be tight or overactive if a client demonstrates feet turning out during the overhead squat assessment? Soleus, lateral gastrocnemius, biceps femoris. Which muscles are overactive if the client's knees move inward? Abductor complex, biceps femoris, TFL, vastrus lataris. Which muscles are overactive if a client's low back arches during the overhead squat assessment? Hip flexor complex and erector spinae. Which muscles are underactive if the client's feet turn out during an overhead squat assessment? Medial gastrocnemius, medial hamstrings, gastrolus, sartorius, and popliteus. Which muscles are underactive when a client's arms falls forward during an overhead squat assessment? Middle, lower trapezius, rhomboids, and rotator cuffs. Which muscles are overactive when a client's head protrudes forward during a pushing assessment? Upper trapezius, sternocleidomastoids, levator scapulae. Which muscles are underactive when a client's head protrudes forward during a pulling assessment? Deep cervical flexors. What strengthening exercise is recommended when a client's feet turn out on the overhead squat assessment? Single leg balance reach. What strengthening exercise is recommended for elevated shoulder movement compensation during the pushing assessment? Ball cobra. What muscles are most appropriate to stretch for a client whose arms fall forward during an overhead squat assessment? Latissimus dorsus, thoracic spine, and pectorals. What muscles are most appropriate to stretch for a client who exhibits an arched lower back during overhead squat assessment? Hip flexor complex, latissimus dorsi, and erector spinae. With which movement compensations is the latissimus dorsi indicated as being overactive in the overhead squat assessment? low back arches, and arms fall forward. Which muscles should be foam rolled when a client exhibits an excessive forward lean? Hip flexor complex, gastrocnemius, and soleus. Which muscles are underactive when a client's knees move inward during a single leg squat assessment? Gluteus medius, gluteus maximus, vastus medialis, oblique. What is recommended strengthening exercise for a client who exhibits arms falling forward during the overhead squat assessment? Squat to row. At what level is a client instructed to squat to when performing the overhead squat assessment? Height of a chair. Which dysfunctional areas often result in non-contact related knee injuries? Ankle and hip dysfunction. The alignment of the musculoskeletal system, which allows our center of gravity to be maintained over a base of support. Structural efficiency. The alignment and function of all components of a kinetic chain under the direct control of the central nervous system. Posture. Which compensations can be observed during the overhead squat assessment from a lateral view? Low back arch, excessive lean forward, arms fall forward. Which compensations can be observed during the overhead squat from the anterior view? Feet turn out, knees move inward. Which muscles are overactive in low back arches movement compensation? Hip flexor, erector spinae, and latissimus dorsi. Which muscles are underactive when the knees move inward on a single leg squat assessment? Gluteus medius, gluteus maximus, vastus medialis, and oblique. What is the tempo for a pulling assessment? Perform it controlled. What movement compensations can be observed during the pushing assessment? Low back arches, shoulder elevation, protruding head. What is the view for single leg squat assessment? Anterior. Which muscles are underactive when the shoulders elevate in a pushing assessment? Middle and low trapezius. What are the dynamic postural assessments movement? Overhead squat assessment, single leg squat assessment, pushing assessment, and pulling assessment. What movement compensations observed when the abdominal complex is overactive? Excessive lean forward. What movement compensations can overactive bicep femoris cause in overhead squat assessment? Feet turn out and knees move inward. What movement compensations can underactive gluteus maximus cause during the overhead squat assessment? Knees move inward, excessive forward lean, low back arches. What movement compensations can be observed in the overhead squat assessment when rotator cuff muscles are underactive? Arms fall forward. What is the corrective strategy for knees move inward as seen in the overhead squat assessment? Tube walking. What is a corrective strategy for feet turning out in the overhead squat assessment? Single leg balance reach. What is the corrective strategy for arms fall forward as seen in the overhead squat assessment? Squat to row. What is recommended strengthening exercise for shoulders elevated in a pushing assessment? Ball cobra. Which muscles are underactive when the low back arches during the overhead squat assessment? Gluteus maximus, hamstrings, intrinsic core stabilizers. Which muscles are underactive with an excessive lean forward? Anterior tibialis, gluteus maximus, erector spinae. What movement compensations are observed with an overactive TFL? Knees move inward, excessive lean forward, low back arches. Note, the TFL is part of the hip flexor complex. What movement compensations are associated with an overactive soleus? Feet turn out and excessive lean forward. What are the guidelines for setting up an overhead squat assessment? Feet shoulder width apart, pointed straight ahead in a neutral position, raise arms overhead and fully extended. What are some regressions for clients unable to perform single leg squat assessment? Use outside support for squatting assistance. Perform single leg balance without squat. What is the corrective strategy for the head protruding forward on a pulling assessment? Keep head in neutral position when performing all exercises. What is a corrective strategy for low back arches as seen in overhead squat assessment? Ball squat. Which muscles are underactive when the low back arches during the pushing assessment? Intrinsic core stabilizers. Provides the foundation from which the extremities function. Static posture. Reflective of how a client is able to maintain bodily alignment while performing functional tasks. Dynamic posture. What are 3 common postural distortion patterns? Lower cross syndrome, upper cross syndrome, pronation distortion syndrome. Increased lumbar lordosis due to an anterior pelvic tilt, lower crossed syndrome. Rounded shoulders with a forward head posture, upper cross syndrome. In which postural distortion pattern might clients exhibit excessive foot pronation, knee flexion, internal rotation, and abduction? Pronation distortion syndrome, knock knees. What are the 5 kinetic chain checkpoints? Feet and ankles, knees, LPHC, shoulders, head. A quick way to gain an impression of a client's overall functional status is in a naturally dynamic setting, movement assessments. How much weight should be added following the warm-up segment of the lower extremity strength assessment, squat test? 10 to 20% of initial load. How much weight should be added following the warm-up segment of an upper extremity strength assessment, bench press test? 5 to 10% of the initial load. Which assessments measures lower extremity agility and neuromuscular control? Shark skill test. How many trials are included in the shark skill test? 1 practice, 2 timed for each foot. 4 graded trials total. Which faults are penalized in the shark skills test? Non-hopping leg touches ground, hands come off hips, foot goes into wrong square, foot does not return to center square. How many repetitions are performed per set in the upper extremity strength assessment? 3 to 5. What is the recommended rest time between progressions during lower extremity strength assessment? 2 minutes. Who should not perform the Davies test? Individuals lacking shoulder stability. What are some examples of performance assessments? Davies test, shark skill test, upper extremity strength assessment, lower extremity strength assessment. How long is the Davies test? 15 seconds. What assessments measures upper extremity agility and neuromuscular control? Davies test. What assessments test upper body neuromuscular endurance? Push-up test. How long is the push-up test? 60 seconds. And those are all 130 flashcards for Module 2. Hope this helps you study.